experts. Welcome back, everybody. WAJR's Ask the Experts continues. Thanks so much for being with us. Today's program being brought to us by HealthWorks, Rehab and Fitness in studio with Sara Stepp, physical therapist, and Dr. Ann Murray, a neurologist at WVU Medicine. And we're talking about physical therapy for neurological problems and diseases. So in our first segment, we kind of did an overview as to defining what a neurological disease is. I'd like to spend some time now talking about treatment options and on a regular basis, what you guys are seeing and starting to see some of the results that folks are seeing. First off, Sara, HealthWorks has got a wide umbrella and range throughout the area. Where are these special services being provided for folks dealing with this?
So the LSVT big treatment is going to be will be provided by me at the Waynesburg HealthWorks, the new location in Greene Plaza, and then also at our Buchanan HealthWorks. And that's specific to Parkinson's disease, really focuses on high intensity, amplitude of movement, big movement, very specific to Parkinson's. But all of our other locations have very highly trained physical therapists. And I think the good thing to note here is that just getting moving and getting in with a physical therapist who is very educated on whatever the neurological problem may be, whether you had a stroke or you have Parkinson's, they can put together an individualized program for you that is focused on what your goals are, whether you want to be able to work on your standing endurance to be able to wash your windows or wash your dishes, or if you want to be able to go out and walk 3 miles, that's what a physical therapist can do, and that is provided at all of our HealthWorks locations.
Dr. Murray, when she said, just get moving, you're shaking your head. It seems as though to you guys, that's the absolute, that once you do receive a diagnosis, don't go back, but rather attack?
Yep, absolutely. I think that I'm often telling folks that, listen, in a perfect world, you would never meet me, and I take no offense to that, but that means you wouldn't have a neurologic disease and you wouldn't need to meet me.
Right.
But the reality is often folks are suffering with these illnesses for months to years. They're a huge impact on their lives. And I often tell them that, yes, as heavy as any neurologic diagnosis is, I get it. I understand that. But this is a starting point. And the good news about making a diagnosis is now we have a plan of attack. Now we have the next step. And that's going to be the focus for the rest of their life. And the goal of any kind of neurologist is that I'm treating them to improve their quality of life, to get them as well as we possibly can, and movement is a big part of it. There is a Parkinson's patient that is part of the Michael J. Fox Foundation, and he speaks regularly, and his name's Jimmy Chu, and his tagline is, find what moves you and move. And I tell my patients that all the time, because that's the key. I don't care what exactly you do, but the goal is do it. Do it, like it. That's going to be the key to kind of getting you feeling better.
What are some of the examples you can tell us about folks that do present and you see them in certain states of not being able to move well, and then once they engage in one of these programs, the difference?
Without a doubt. Yeah, lots of them. So probably too many to kind of think of specifically, but a general kind of story or often lots of patients that come to my mind are folks that come in. We make a diagnosis, we get them on the right treatment. I can't emphasize enough, getting the right diagnosis is key, meaning that unfortunately folks can get very frustrated if they don't feel like they're getting answers, and we get that. And that's really our goal as specialists. That's our goal, is to really give you the answer that you've been looking for so that we can start moving forward. We're no longer kind of stuck in that rut of figuring out what is the problem. Once we diagnose what's going on, then we can really have this treatment plan to move forward. We get you on the right medications, the right kind of foundation. And that's really how I relay it. This is the foundation. Then getting you into therapy is essential. I tell my patients all the time, if it was up to me, you would be in therapy every day, the rest of your life. We should all be kind of doing that, right? I mean, the reality is, whether I have a neurologic disease or not, I should be exercising. I should be active. That's how we're going to maintain health. And that's very, very true. When we take that patient, that we finally get them on the right medication and get them in therapy, I have lots of patients that when they came into me, they could barely walk down the block. By the time we start medications and get them into therapy, they're walking 5Ks, they're running 5Ks, they're living their life. And that's the point. They're living their life. And that is always my goal.
Yeah, that's fantastic. And Sarah, earlier on, you used a 4 initial LS.
VT.
So walk us through that.
So it makes it a little confusing because it stands for Lee Silverman Voice Treatment. It started out as speech therapy for patients with Parkinson's because they typically have a lower or softer voice. And they had excellent results with it. So then they created the big program, which focuses more, it's the same concept, same idea, but it focuses more on movement and big amplitude of movement, high intensity, big amplitude. So to summarize, patients with Parkinson's typically move small, and then they don't have that self-awareness to realize that they're moving small. They think that they're moving normal. So the focus of this program is to increase that amplitude, move big, and then change their perception of that movement so that even though they feel they're moving bigger, they then start to realize this is a normal movement. And that's what we call calibration. That is the ultimate goal of the program.
And these services are available to you from the folks at HealthWorks. And there's more to talk about. The two ladies that you're listening to, Sara Stepp and Dr. Ann Murray, again, they'll be hosting a free HealthWorks for You seminar specifically on physical therapy for neurological problems. That's coming up on Thursday night, October the 10th at HealthWorks Maple Drive location. It begins at 7 o'clock. And if you've got any questions or comments, once again, no reservations needed, but if you want some more info, just call the folks there at HealthWorks. We'll talk more about it when we return. You're listening to WAJR.